Mr. President,
The senator from Colorado.
I want to thank the senator from Alaska for convening this important discussion we've had here this morning. Mr. President, as you've heard, we've all heard over the last hour, my colleagues and I agree that the point of health care reform is to bring affordable, quality health care to all Americans. And the bill that we'll debate here on the floor in the coming weeks will include important insurance reforms to make that a reality. I want to ask you, though, Mr. President, and everybody watching, will we have succeeded in our mission if we merely put an insurance card in every American's pocket? Comprehensive health care reform needs to be about a lot more than that. We've heard about the difficult fiscal challenges that await us if we do nothing. Putting our economy on a sustainable basis for the future means that we have to address this unsustainable growth in health care spending that you so eloquently addressed earlier in your remarks. And one of the ways we can really do that is by preventing illness in the first place. The good news is that many communities and providers all over our country are doing just that. We can recognize their innovative successes and incentivize others to follow in this reform package. We do that, we have a big impact on patient health, but also on the nation's bottom line. I want to talk about a program in Colorado that's been getting results. The Northwest Colorado Visiting Nurse Association, which has been working with the Department of Public Health, local physicians, and others, operates the Aging Well program. It focuses on prevention, and it connects rural Coloradans over age 50 with services and information to help them remain active, healthy, in their homes and out of the hospital. Patients receive health screenings, exercise classes, and courses on managing chronic conditions like arthritis or chronic pain. It's been a great success. Aging Well has been a great success. Listen to these numbers from a recent survey. 98% of participants reported improved fitness. 60% visited their doctor less often, and 18% had reduced their medication needs. This saves dollars and improves lives. Now, Mr. President, health insurance reform legislation includes funding to start similar programs, yet keeping those just shy of their Medicare years, I have to confess, like me, active and healthy. The goal is to allow Americans to avoid spending their golden years worrying about illnesses that could have been prevented in the very first place. To complement these programs, additional grants would give local organizations the tools to promote healthy living for all ages, reduce rates of obesity, tobacco use, and mental illness. Health reform, Mr. President, would also require insurers to provide full coverage of preventive services at no cost to enrollees. That's music to the ears of any American who's been prevented from a mammogram or an annual physical exam because the cost was too great. Let me talk about children as well. There are grants in our health reform package for school-based health clinics so that children who lack easy access to a doctor can get preventive care right at school. These clinics have been shown to save $2 for every dollar that they spend. And this results in less emergency room visits and hospital visits, and we deliver health care before problems become more serious. Let me turn back to adults in the workplace. Mr. President, reform would bring wellness programs to the workplace by providing grants for employers. Companies that have implemented wellness programs have already seen big savings. PepsiCo is one such company. They offer on-site screenings, programs to help employees lose weight, exercise incentives, and other measures. And as a result, they've saved nearly $120 per participating employee per month, which has resulted in a 2-year savings of over $22 million. Even better than the dollars involved here, participants demonstrated lower health risks and better health outcomes. This is one more way reform will pave the way and provide incentives for more companies to follow suit for their employees. Reform, Mr. President, is also a great deal for seniors. Medicare for the first time will pay for annual wellness visits. Reform would create incentives for Medicare patients who alter their behavior in order to lower their blood pressure and better control their diabetes. And Medicare would cover recommended preventative services now, which is at no additional cost to seniors. In some, Mr. President, contrary to what we've heard from some on the other side, Medicare will be strengthened by this reform that's being proposed. So let me conclude, Mr. President, by pointing out that this legislation makes the wise choice of building our wellness efforts that are already working. We know that preventative care enables doctors and others to detect diseases earlier when treatment is most effective, averting more serious and costly health problems later on. But it also empowers each and every one of us to take charge of improving the quality of our lives. And when done correctly, it's a crucial component of efficiently and responsibly addressing health care spending. Thank you, Mr. President. I yield the floor.